Over to this now. Limpopo's Health MEC is worried about the COVID-19 cluster outbreak at Exxaro Mine in Lephalale. Over 50 new cases were recorded at the mine this week alone. To discuss this further, let's bring in Limpopo Health MEC, Dr. Phophi Ramathuba. Thank you so much for your time, MEC. Speak to us about how worried you are with this new variant, Omicron, and the fact that Limpopo has also been identified as a province where there has been a spike in infections, especially with this variant.
Afternoon to all of us. Yes, of course, as a province, we're really worried. With this past week, we have seen cluster outbreaks that within a space of past 5 days, just in Exxaro Mine, we've been able to detect over 57 cases. And the situation, it's really not necessarily going down. We will we'll be closely monitoring them. The good thing is that the mines have been very progressive by working with us in terms of the fight of COVID-19 since the outbreak of this pandemic. Now, their active surveillance program and also they never stopped screening and testing, even when, as a province, we were registering very numbers, sometimes not even registering numbers. So that is what has assisted us. But of course, of concern is the fact that majority of those people are testing positive. Those who presented with symptoms during screening are those workers who have not been vaccinated. And those who were vaccinated were able to pick up as contacts. And what comforted us is the fact that they are not necessarily symptomatic. We're just isolating them. And the mine is also providing resources for isolation. So the bad news of the Omicron variant, when it was broken to us and we find ourselves as Limpopo being counted amongst, because you can't separate Limpopo from Gauteng. Whatever happens in Gauteng, as a province, we always know that it's going to flow over to us. Has not assisted the situation, and that is why now we are calling upon the people of Limpopo to be vigilant now, and those of us who have started to be complacent in terms of wearing of our mask and sanitizing. It's a high time now that you have to, at all times, wear your mask as long as you are out of your household. Actually, when you leave your bedroom, make sure you're wearing your mask.
Sure. MEC, so would you say that there's a concern with the amount of travel that happens between Gauteng and Limpopo that could possibly be the contributing factor that you're seeing the increase of the Omicron variant in Limpopo? Let's just exclude the mine and that particular case, but overall infection rates in Limpopo.
The infection rate is still low. We have not, if you remove the cluster outbreaks, your numbers are not yet bad. But at the same time, if you compare to what we were seeing in the past 2 weeks, you must start to be worried. Because if you look now at places like Capricorn or Polokwane, which is our city in the definition of Limpopo, we know that we are now having more than 79 active cases, and that was not the case. So that simple tells you that even if you take away the mining factor, you should know that the numbers are increasing. We are starting to experience a spike. That is why now the active surveillance, now we have activated our teams to go back to the strengthening of the contact tracing. And we are also asking other, especially employers and people, businesses where you have got employees working at close range, for instance, to learn from what the mines have been doing, such that if we are able to say every employer, they now start to screen vigorously everyone who comes, and then we will be assisting with the testing. We will then be able to cap the spread. Because if we don't do that, people will be positive and continue to spread the virus without even knowing that they are positive, especially those that have been vaccinated. And those who are not vaccinated, who have got other medical conditions, unfortunately, they are the ones who are going to clog our healthcare system. And that is why we are saying we are becoming proactive and saying, let's forget about the cluster outbreak and start to say within our community, let's bring back our community healthcare workers now. As we are spreading the gospel of vaccinate, let's also remind people to say, wear your mask religiously, so protect yourself and your family during this period.
Sure. Just lastly, MEC, Limpopo has always been a province that many looked at and were quite concerned about, given the rural and remote areas in this province. But it's also been a province that has been identified as high vaccination numbers, especially in the vulnerable age group, but also the province that was one of the only provinces that recorded zero infection rates. I think it was for 1 or 2 days a couple of weeks ago. Does it bring you any comfort that now with this new Omicron variant, we are able to say that at least Limpopo has a high vaccination rate and your team is on the ground to try and make sure that there isn't a spread?
What we can indicate is that the Limpopo Provincial Command Council, which is chaired by our Premier, Mr. Matawata, and the entire Executive Council, together with our executive mayors and mayors in different municipalities, since the outbreak of COVID-19, they have been very much active on the ground. Department of Health, being the lead department, has always been providing technical expertise and support. And actually, when they come to us and we give them a proposal to say this is how we must go and run, starting with the preventative way, how do we get into the malls and talk to people, how our police, our traffic officers, we have been working together from last year at roadblocks everywhere, even during the vaccination period. As a province, we've been working as a province with all stakeholders. Our churches, everybody has been on the ground to support the work that government is doing. So now, even now, what we're saying, you can see we always on the ground. That is why we are able to pick up our own cluster outbreaks before even nation could begin to tell us. As soon as the NICD, our officials who are deployed by NICD to the province, they've got direct contact with me. And as soon as they pick up something that they're not happy, they immediately alert us and we deploy the team and we send our leadership to that area. Like, for instance, Exxaro Mine, we know people who work in the mines are coming from outside. And if you look at Lephalale, it's bordering Botswana and also South Africa and Limpopo. So you should be expecting that to say these are mining areas which are within the borders of the province and other provinces and other countries. So you pick that up early, because what is important in COVID-19, if you are able to screen vigorously and you are able to test and pick up the cases early, you then are able to interrupt the spread by making sure you isolate, you quarantine those who are infected. In that way, you will stop the spread. So that's what we've been doing as a province. Hence, even now, we're not going to drop the ball. We are panicking currently, but panicking in a positive way to say, look, we are being told about this Omicron variant, even if we were not told that it's detected in Limpopo. The mere fact that it's detected in Gauteng, it automatically tells you you have them in Limpopo, because every Friday, people from Limpopo are on N1 from Gauteng coming home. Every Sunday, they are going back to work. They work in Gauteng and they stay in their rural villages of Limpopo. Whatever happens in Gauteng, we will never separate it from the province. We work closely with the Gauteng government, and whenever they alert us on something, we also go on the ground and make sure we protect and prevent our people from that. And what is important, lastly, is that We know ourselves. We said it from the beginning of this pandemic. Our material conditions dictate that we've got to work differently from other provinces. We don't have those luxury of resources. We don't have those academic hospitals. We don't have the 5 stars. We don't have state-of-the-art hospitals. We're rural. So the only way you can defeat a pandemic like COVID-19 is if you strengthen your preventative methodology. If you put more efforts on vaccination, it will assist you. Because for us, we will never win this battle in ICU. We've seen that even rich countries fail to win the battle of COVID-19 in the ICU. But we know for a fact you can win it on the street, and hence a vaccination. It's one way of winning this battle, which is scientifically proven, on the street.
Great. Thank you so much for those insights. And I think the message is very clear. If you haven't been vaccinated, you should go and do so because the data is very clear. That's Limpopo Health MEC, Dr. Phophi Ramathuba.